A presentation of the University of Alabama in Birmingham Dental Television System. Dental Anatomy. Introduction and Nomenclature. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright Jr., and Dr. Michael Hughes. Introduction. The teeth are arranged in two arches, the upper and lower. Those in the upper arch are termed maxillary because they are set in the upper jaw, which is called the maxilla. The teeth in the lower arch are termed mandibular because they are set in the lower jaw, which is the mandible. The mandible is the movable member of the two jaws, while the maxilla is stationary. An imaginary line which divides each arch, as well as the body, into two approximate halves is the midline. The two approximately equal portions of each arch divided by the midline are termed quadrants. Consequently, there are four quadrants in the mouth, and they are termed the maxillary right quadrant, the maxillary left quadrant, the mandibular right quadrant, and the mandibular left quadrant. Classification of the teeth. The permanent dentition. There are normally 32 teeth in the adult permanent dentition. These teeth usually erupt from 6 to 21 years of age. Each quadrant of the permanent dentition contains 8 teeth of differing type and function. Incisors. There are 2 incisors in each of the quadrants, the central incisors and the lateral incisors. These are the 2 teeth in each quadrant which closest approximate the midline. In mastication, their function is that of cutting and incising. Canines. The canines are the 3rd teeth from the midline in each quadrant. Their function in mastication is cutting, tearing, piercing, and holding. They are also called cuspids. Premolars. The 4th and 5th teeth from the midline are called premolars. Their masticatory purpose is tearing, holding, and grinding. These teeth are frequently called bicuspids. They are correctly termed 1st and 2nd premolars. Molars. The 6th, 7th, and 8th teeth from the midline in each quadrant are termed the 1st, 2nd, and 3rd molars. They are commonly referred to respectively as the 6-year molar, 12-year molar, and wisdom tooth. The function of the molars is that of grinding. With this classification in mind, the anthropologic formula for man's permanent dentition is as follows: I, 2/2, C, 1/1, P, 2/2, M, 3/3, equals 16. I represents incisors. 2/2 indicates that there are 2 incisors in each of the maxillary and mandibular quadrants. C represents canine, and the 1/1 indicates there is 1 canine in each of the maxillary and mandibular quadrants. P represents premolars, and the 2/2 indicates that there are 2 premolars in each of the maxillary and mandibular quadrants. M represents molar, and the 3/3 indicates that there are 3 permanent molars in each of the maxillary and mandibular quadrants, for a total of 16 permanent teeth in 1/2 of the adult dentition, or in 2 quadrants of the permanent dentition. The deciduous dentition. The deciduous dentition is those teeth which are commonly referred to as baby teeth, milk teeth, or the primary dentition. They are so named because they are shed or exfoliated during growth and development. They normally erupt into the mouth within the first 2 years of life. Deciduous teeth are exfoliated from the 7th year on by a natural process brought about by resorption of their roots. Succedaneous is the term used to describe a permanent tooth which takes the place of a deciduous tooth. Normally, there are 20 deciduous teeth, which are replaced by succedaneous teeth. Since there are 32 permanent teeth, it may be said then that all permanent teeth are not succedaneous. Each quadrant of the deciduous dentition contains the following types of teeth. Incisors. There are 2 incisors which are named the central and lateral incisors. Canine. There is 1 canine in each of the maxillary and mandibular quadrants. Molars. There are 2 molars in each of the maxillary and mandibular quadrants, which are named first and second molars. Each of the teeth have functions similar to their permanent complements. The deciduous dentition for man has the following dental formula: I, 2/2, C, 1/1, M, 2/2, equals 10. The universal numbering system. The universal numbering system is the most widely used system for designating, by abbreviation, the various teeth for identification. In the permanent dentition, numbers are assigned in consecutive arrangement for each tooth, and in the deciduous dentition, alphabet letter designation is used. Permanent teeth. In the universal numbering system, the number 1 is assigned to the maxillary right third molar, the number 2 to the maxillary right second molar, and so forth, around the entire maxillary arch to the maxillary left third molar, which is numbered 16. The succession drops to the mandibular left third molar then, which is numbered 17, and continues around the entire mandibular arch to the mandibular right third molar, which is numbered 32. Deciduous teeth. The 20 teeth of the deciduous arch are designated through the use of capital letters A through T, in the same sequence as described with the permanent dentition. The terms which have just been introduced, as well as other anatomical features, must be mastered and become a part of a dental vocabulary to enable the necessary communication for further study of dental anatomy. These anatomical features are as follows. Alveolar process. The alveolar process is that part of the maxilla or mandible which surrounds and supports each tooth. Alveolus. The alveolus, or socket, is that portion of the alveolar process into which the teeth are set. The plural of alveolus is alveoli. Crown. The crown is that portion of the tooth which is covered by enamel. This is correctly referred to as the anatomical crown. That portion of the tooth which is visible in the mouth may or may not correspond to the anatomical crown, depending on the level of the soft tissue. That portion of the tooth which is visible in the mouth is referred to as the clinical crown. Root. The root is that portion of the tooth which is covered with cementum. As noted in the crown, the anatomical root may or may not correspond to the clinical root. The anatomical root is that portion of the tooth which is covered with cementum, while the clinical root is that portion of the tooth which is visible in the mouth. Apex. The termination or tip of a root is known as the apex. The plural of apex is apices. Enamel. The enamel is the hard mineralized tissue which forms the outer layer of the anatomical crown of a tooth. It is the hardest of the body tissues. Dentin. Dentin is the tissue which forms the main body of the tooth. It is covered by enamel in the anatomical crown, cementum in the anatomical root, and surrounds the pulp cavity. Cementum. Cementum is the thin layer of bone-like hard tissue which covers the dentin of the anatomical root of a tooth. Pulp. The pulp is the soft tissue within the tooth which provides the dynamic vitality in the form of blood vessels, nerve fibers, and lymphatic vessels. Pulp cavity. The pulp cavity is the entire central cavity of a tooth which contains the pulp. The pulp cavity is divided into one or more pulp canals, a pulp chamber, and one or more pulp horns. Pulp canal. The pulp canal is that portion of the pulp cavity which is located in the root of the tooth. Pulp chamber. The pulp chamber is the enlarged portion of the pulp cavity which lies in the central portion of the anatomical crown of the tooth. Pulp horn. The pulp horn is the elongation or extension of the pulp chamber, which usually corresponds to the cusps or lobes of teeth. Dento-enamel junction, or DEJ. The dento-enamel junction is the designation given to the interface between enamel and dentin in the anatomical crown of the tooth. Cervical line. The junction of the cementum and enamel on the surface of the tooth is referred to as the cervical line. It is also frequently called the cemento-enamel junction, or the CEJ. The cervical line separates the anatomical crown and the anatomical root. Periodontal ligament. The periodontal ligament, or periodontal membrane, is the designation given to the fibrous attachment of the tooth cementum to alveolar bone. This is a ligamentous attachment. Gingiva. Gingiva, or the plural of which is gingivae, refers to the gum or gums. This is fibrous tissue which is enclosed by mucous membrane overlying the alveolar process and surrounding the teeth. Anterior teeth. Anterior teeth is the term used to designate the teeth in either arch, which are located in the front of the mouth or arch. These teeth include the incisors and canines in both the deciduous and permanent dentition. Posterior teeth. The posterior teeth are those teeth in either arch which are located toward the back of the mouth. These include both premolars and molars. Tooth surfaces. Mesial. The term mesial refers to the surfaces toward the midline. This designation refers to adjacent surfaces within a given quadrant. Distal. The term distal refers to the surfaces away from the midline. Labial. Labial is the term used to designate those surfaces of the anterior teeth which are toward the lips. Buccal. Buccal is the term used to designate the outside surfaces or surface toward the cheek of posterior teeth and corresponds to labial of anterior teeth. Facial. The term facial is used as a singular name for either labial surface of anterior teeth or buccal surface of posterior teeth. Lingual. The lingual is the surface toward the tongue or inside of the dental arch. Palatal. The lingual surface is sometimes referred to as the palatal surface on both anterior and posterior teeth of the maxillary arch as it approximates the palate. Incisal. The incisal refers to the biting surface or edge of the anterior teeth. Occlusal. Occlusal is the term used to refer to the chewing surface of posterior teeth. Proximal. This term refers to any surface between two teeth. Therefore, a proximal surface, by definition, can only be mesial or distal. Line angle. A line angle is an imaginary line or angle formed by the junction of two surfaces and takes the name of the involved surfaces. On each tooth, there may be demonstrated 8 line angles. In naming line angles, the names of the surfaces are combined by dropping the IAL or AL from the end of the first surface and substituting an O. Where two O's are adjacent, they are separated by a hyphen. The following are the 8 line angles of the crown of each tooth. In anterior teeth, these are designated as mesiolabial, mesiolingual, distolingual, distolabial, labioincisal, linguoincisal, distoincisal. And mesioincisal. In posterior teeth, these lines are designated as mesiobuccal, mesiolingual, distolingual, distobuccal, bucco-occlusal, disto-occlusal, linguo-occlusal, and mesio-occlusal. Point angle. A point angle is the point at which the junction of 3 surfaces occurs and takes the name of those involved surfaces. There are 4 point angles demonstrated on each crown. In anterior teeth, these are designated as the distolabial incisal, the distolinguoincisal, the mesiolabioincisal, and the mesiolinguoincisal. In posterior teeth, these are designated as the distolinguo-occlusal, the distobucco-occlusal, the mesiobucco-occlusal, and the mesiolinguo-occlusal. Contact area. The contact area refers to that area on a proximal surface that contacts the adjacent tooth in the same arch. All teeth have two contact areas except the most distal tooth in each quadrant, which has no distal contact. Crown elevation. Mamelons. Mamelons are small rounded projections of enamel which are evidenced on the incisal of newly erupted anterior teeth. They are normally worn away soon after eruption. Cingulum. The cingulum is a large rounded eminence on the lingual surface of anterior teeth located in the cervical 1/3. Cusps. Cusps are the elevated projections on the crowns of teeth. Incisors do not possess cusps, although canines normally exhibit one cusp. Premolars, 2 or 3 cusps, and molars, 4 or more cusps. Ridges. Ridges are linear elevations on the surface of the crowns of teeth and are named by location. Marginal ridges. Marginal ridges are linear elevations found on the mesial and distal of the occlusal surface of posterior teeth. Marginal ridges are also found on anterior teeth, where they form the lateral margins of the lingual surface. Triangular ridges. Triangular ridges are linear ridges of posterior teeth which descend from the tips of the cusps toward the central area of the occlusal surface. Transverse ridge. A transverse ridge is a combination of two triangular ridges which transversely cross an occlusal surface to merge with each other. A transverse ridge is simply a union of two triangular ridges which is uninterrupted. Oblique ridge. An oblique ridge is a special type of transverse ridge found on maxillary molars which runs obliquely on the occlusal surface from the distal buccal to the mesiolingual cusps. Cusp ridges. Each cusp has 4 cusp ridges. These are ridges which extend in a different direction from the cusp tip. They are named according to the direction toward which they extend. Inclined plane. An inclined plane is the sloping area found between 2 occlusal cusp ridges and are named by combining the names of the 2 occlusal cusp ridges between which they lie. Crown depressions. Sulcus. The sulcus, the plural of which is sulci, is a long, narrow depression, usually V-shaped in cross-section. It is located on the occlusal surface of posterior teeth, in the bottom of which is found a developmental groove. Fossa. The term fossa, the plural of which is fossae, is an irregular, usually rounded depression or concavity on the surface of a crown. Developmental groove. A developmental groove is a coalescence or line which is the junction of the primary lobes in the development of the crown of a tooth. Supplemental groove. A supplemental groove is an auxiliary groove which branches from the primary developmental groove. These grooves are not identified by name. Pit. A pit is a small depressed area where developmental grooves meet. It is normally the deepest portion of a fossa. Lobe. A lobe is one of the primary anatomical divisions of the crown of a tooth. Lobes are usually separated by identifiable developmental depressions. Divisions of crown and roots. For descriptive purposes, the crown surfaces of teeth are divided into imaginary thirds, both horizontally and vertically. The root surfaces are divided only horizontally. The divisions of thirds are named by their location, according to the surface from which they are viewed. The proximal surface of the crown of an anterior tooth exhibits a labial, middle, and lingual third when divided vertically. When divided horizontally, the same proximal crown surface has an incisal, middle, and cervical third. The root has only horizontal thirds, which are termed cervical, middle, and apical thirds. From a labial view of the crown, the same vertical divisions are made, presenting a mesial, middle, and distal third. Again, the horizontal divisions are designated as incisal, middle, and cervical thirds. The division of the root into thirds remains the same: cervical, middle, and apical. In posterior teeth, the vertical division of the crown of the tooth from a proximal view is designated as the buccal, middle, and lingual thirds. The horizontal divisions of the crown of a posterior tooth are designated as the occlusal, middle, and cervical thirds. The roots of the posterior teeth are divided only into horizontal thirds, designated as the cervical, middle, and apical thirds. From a buccal view, the crown of a posterior tooth is divided vertically into a mesial, middle, and distal third. When divided horizontally, the same posterior buccal surface of the crown has occlusal, middle, and cervical thirds. Again, the root is divided into cervical, middle, and apical thirds.